my name is Sharon Derby. I'm an Augusta University DNP nursing student. I'm here today to do a physical assessment on you. Can you tell me your name and date of birth?
Jordan Derby, March 29th, 2001.
Oh, great. And how are you doing today, Jordan?
I'm doing good.
Are you having any pain?
No.
Okay, great. To start off with, I'm going to assess your cranial nerves. You have 12 cranial nerves. The first one that I'm going to assess is your olfactory cranial nerve. I'm going to have you close your eyes, and I'm going to place a scent of something under your nose, and then I'll ask you just to tell me with your eyes closed what that scent is. Okay?
Okay.
All right. First of all, let's just occlude your nostril. Sniff. Okay, so sounds patent. Sniff. Okay, sounds patent. Okay, go ahead and close your eyes, Jordan. Okay, what is this scent?
It's like syrup.
Okay, great. You can go ahead and open your eyes. Okay, Jordan. I know you've got glasses, and your glasses are probably to correct for your vision. We use a visual acuity chart. It's called a Snellen chart to assess your visual acuity. And this chart would tell us how well you can see. If you have 20/70 vision, you can see at 20 feet what somebody who has perfect vision can see at 70 feet. So then, of course, that would mean that you need glasses. Let's go ahead and take off your glasses. Okay. And visual acuity is checked and assesses your cranial nerve 2. I'm now going to check your cranial nerves 3, 4, and 6 to check for your extraocular movements, and also 2 for your pupillary response. Okay, just look right at my nose. Pupil reaction is brisk. Right pupil reaction is brisk. Okay, I've got a blue pen. I just want you to follow my pen using your eyes only. Okay, so cranial nerves 3, 4, and 6 are intact. Extraocular movements are intact. Okay, so now I'm going to assess cranial nerve 5. That's your trigeminal nerve. I'll assess your temporomandibular joint. Go ahead and open your mouth. Any pain? Close.
No.
Okay, I heard no clicking, and there was no crepitus to the TMJ, so it's intact. I'm going to check your sensation. This is a dull touch. This is a sharp touch. And then this is a soft touch. And when I touch your face with this object, just let me know if you feel sharp, dull, or soft, okay? Close your eyes.
Dull. Soft. Sharp.
Okay,
Sharp.
okay,
Dull.
okay, good.
Soft. Soft.
Okay, great. So sensation is intact. You can open your eyes, Jordan. I'm going to bring cotton close to your eyes. Just want to see what the reaction would be. Okay, he blinked. Okay, and he blinked. Great. So the next one I'm going to check is your facial cranial nerve. That's cranial nerve number 7. Trigeminal cranial nerve is intact. Okay, let's check your facial nerve number 7. I'd like you to raise your eyebrows for me. Okay, and smile. Show your teeth. Puff out your cheeks. Frown. Facial nerve is intact. I'm going to assess your cranial nerve number 8. I'm going to activate my tuning fork, and I'm going to place it on your mastoid process. You're going to hear a vibration, okay? When you no longer hear that vibration sound, I'm going to turn the tuning fork this way towards your ear, and when you no longer hear that sound, let me know, okay?
Okay.
Okay, great. So the air conduction was longer than the bone conduction, so that's good.
I no longer feel it.
Okay.
I no longer feel it.
Okay, great. So that's good. So air conduction is greater than bone conduction. That's called the Rhine test, the Rennie test. Now I'm going to do this. I'm going to activate my tuning fork. I'm going to place it on your head. You're going to hear a vibration. You let me know if you hear the sound better in your right ear or your left ear or equally on both sides, okay?
Okay. Equally.
Okay, great. So that's a good test. And now I'm going to whisper a series of letters and numbers, and you tell me what you hear, okay?
Okay. A46.
Okay.
E37.
Okay, good. So that was your acoustic cranial nerve and it's intact. Okay, and now I'm going to check cranial nerves 9 and 10. That's your glossopharyngeal cranial nerve and also to your vagus cranial nerve. All right. So go ahead and open your mouth for me. I'm just going to look at your soft palate. Say ah. It raises and your uvula is midline. Okay, move your tongue from side to side. Good tongue movement. Okay, great. All right, and then I'd like you to swallow for me. I see that he is not drooling, and because he's not drooling, I know he's got a good gag reflex because he's not drooling. The tongue movements were symmetrical bilaterally. There's no tics, there's no fasciculations. So cranial nerve 9 and 10 are intact. I'm going to assess your spinal accessory nerve. I'm going to put my hands on your shoulders. I'm going to push down on your shoulders. Do not let me push down your shoulders, okay?
Okay.
Okay, good. Nice and strong. I'm going to put my hand against the side of your face. Do not let me push your face, okay? Okay, good. And on the other side. Spinal accessory nerve is intact. The last cranial nerve is cranial nerve 12. It's the hypoglossal. It is intact because his speech is articulate, his voice is clear, his tongue movements were uniform, bilaterally symmetrical, and there's no tics or there's no fasciculations. So your cranial nerves are all intact, and that ends your cranial nerve assessment. The next assessment I'm going to do, Jordan, is to assess your head, your skin, your nails, your eyes, ears, nose, and throat. Okay? All right, so let's start off with your head. I'm just going to palpate your scalp. I do not feel any depressions. I don't feel any soggy or boggy spots. Do you have any pain?
No.
His hair is uniformly distributed on his head. It's curly and dark, like a dark brown color, and his hair is clean. Let's go ahead and take a look in your ears. Any pain?
No.
Oh, Jordan, you've got a fair amount of cerumen in your left ear, so I'm unable to really see your tympanic membrane. So you might need to do some more hygiene to your ears, okay?
Okay.
Let's take a look in this ear. Fair amount of cerumen here too, Jordan. Looks like, oh, but I do see a light reflex. Yep, I definitely see a light reflex in your right ear. but there is some cerumen, so you're gonna have to do some good hygiene. Maybe use a curette to clean the earwax out, okay?
Okay.
Not Q-tips, because the Q-tips will push the earwax further, so use a curette, okay? Those you can purchase at the drugstore. All right, and I don't see any drainage from his ears. The auricle and the pinna are intact. All right, let's take a look in your eyes. Got my ophthalmoscope, and take a look in your right eye. Okay, just look kind of over my shoulder a little bit, okay? Okay, I see a red reflex in your right eye. And let's take a look in your left. Okay, I see a red reflex in your left eye. I'm just going to, sorry that light is very bright, I know. I'm just going to go ahead and palpate your lacrimal apparatus. I do not see any ptosis to his eyelids. There's no drainage. His eyes are bilaterally symmetrical. His eyebrows are bilaterally symmetrical. The hair is evenly distributed. His conjunctiva, open your eyes for me, Jordan. Conjunctiva is pink. Conjunctiva is pink, and the sclera are both white and clear. Okay, let's take a look in your nostrils, Jordan. Okay, the mucosa is pink, and I see some nasal hairs. The turbinate is open and patent on the left side. Turbinate is open and patent on the right side. The mucosa is pink, and there's nasal hairs also. All right, very good. Go ahead, Jordan, and open your mouth for me, please. I know I've done this assessment looking in your mouth, but now I'm going to look at your teeth and your mucosa. His mucosa is pink. There is no white patches. His teeth are white and clean. Let's look at your gums. Show me your gums. Gums are pink. Looks like we could do some hygiene though, Jordan, with your flossing, okay? Teeth, I see no caries, no dental caries, and there are no white patches anywhere. No fasciculations to the tongue, and the tongue is midline. Okay, great. And with your cranial nerve assessment, I asked you to say and I saw your uvula midline, and I saw your soft palate raise. Okay, let's look at the trachea. Trachea is midline. It's not deviated to the left or to the right. I'm going to auscultate and palpate your thyroid gland, okay? Let me come from behind and check your thyroid. Okay. All right. I'm just going to displace your thyroid gland a little bit. I'm just going to palpate. Can you swallow for me? Okay, I felt this thyroid gland move up and down. Okay, I'm going to displace a little bit. Okay, can you swallow for me? It does not feel nodular to me. Okay, that's good. Let me go ahead and auscultate and listen to your thyroid gland. And while I'm here, I'm also going to palpate your carotid artery. Okay, nice and strong. And I'm going to auscultate your carotid artery and your thyroid. Let's start off with your thyroid. Okay, I'm going to auscultate your thyroid for any bruits. Bruits are sounds of turbulent blood flow. I hear no bruits, no turbulent blood flow. That's great. Okay, Jordan, go ahead and hold your breath. I'm going to auscultate over your carotid artery. Okay, I hear no bruits, no sound of turbulent blood flow. Okay, you can breathe, I'm sorry. Go ahead and breathe. Okay, now hold your breath. I'm going to auscultate on the right side. Okay, no sound of turbulent blood flow, so that's good. I'm going to palpate your temporal artery. It's nice and strong. Nice and strong. I'm going to also palpate your lymph nodes. You have a lymph node in front of your ear. It's called your preauricular. It's not palpable. When a person has an infection, their lymph nodes can become enlarged. Posterior auricular. I'm not able to palpate. Back here is your occipital lymph nodes. Okay. Submandibular. Right here, submandibular, and then submental under your chin. Your tonsillar about right here. Not able to palpate anything. Tonsillar is about right here. Your anterior cervical chain. And then your posterior cervical chain. And then supraclavicular. Okay, great. So I've assessed your head. Let's go ahead and, I do want to assess your sinuses, Jordan, okay? So these are your maxillary sinuses. Are you having any pain here?
No.
Okay, how about here?
No.
Okay, how about here with your frontal sinuses?
No.
Okay, great. So no pain there. So that's good. All right, Jordan. So I'm going to have you, while you're sitting up in the chair, I'm going to assess your muscle tone and do some other special tests with you, with your upper and lower extremities. And then when you lie down on the couch, I'm going to assess your heart, your cardiovascular system, and your peripheral vascular system as well too, your respiratory system, and your bowel sounds, and also some muscular assessments. Okay? All right. So let's check your joints. What I'd like you to do is to turn your neck from side to side, and then up, and then put your chin to your chest. Are you having any pain? I heard no sounds or no clicks, no sounds of crepitus to his neck joints. Okay, let's assess your shoulders, okay? Raise your arm all the way up, your left arm, and back a little bit, as far as you can. Okay, great, and then arm down. Okay, and then across your body as if you're trying to scratch your back. Okay, good. Do you have any pain?
No.
And I heard no sounds of crepitus or sounds of grating sound with your joint, your shoulder joint. Okay, go ahead with your right arm and do the same thing. All the way up. Okay, back as far as you can. Down. And then across your body as if you're trying to scratch your back. Any pain?
No.
No sounds of crepitus. Okay, go ahead and bend your arms at your elbow. Any pain?
No.
No sounds of crepitus. Very good. And then with your wrists, go ahead and circle your wrists like this. And then the other way. Okay, great. Thank you so much, Jordan. Wiggle your fingers as fast as you can. Okay, great. What I'd also like you to do is to touch, Jordan, your finger, all of your fingers to your thumb. As fast as you can. Rapid alternating movements. Great. And then now your other hand. As fast as you can, Jordan. Thank you so much. That's great. Okay, any pain?
No.
Okay, and then there was no crepitus heard either. While we're on your arms, Jordan, I'm going to check your muscle strength with your upper extremities, and then we'll do the lower extremities, okay? All right, make a big bicep for me. Okay, so what I'm going to do is I'm going to push your arm. Don't let me push your arm, okay? Okay, very strong muscle strength, and your muscles are toned. I see no atrophy to your muscles. Okay, let's try your right arm. Okay, and now I'm going to pull, go ahead and do that again, nice and strong. I'm going to pull your arms towards me, don't let me pull you. Okay, wow, very strong young man. Great, and as I said earlier, the muscles are not, there's no atrophy, and they are strong and firm muscles. Okay, let's go on ahead now, Jordan, and I'm going to check your reflexes with my reflex hammer, okay? Just relax your arm, just right there on your side, both just relax them, just nice and relaxed. Okay. Oh, good, nice reflex. There's your biceps deep tendon reflex. great. And then let's try your triceps. Deep tendon reflex. Just let your arm kind of hang limp. I'll hold it up, just kind of let it hang limp. Just check your triceps reflex. Okay, good. Put your arm back. And then we'll do this one. And just let it hang limp here. Okay, good. And then we'll check your brachioradialis and just let your hands just kind of lie limp at your wrist there. It's going to go a little bit above the radial condyle. Okay. Jordan, do you spend a lot of time on the computer typing or using your hands on the computer?
Yes.
I'm going to check to see if there's any carpal tunnel syndrome. Okay. So I'm just going to tap along the medial nerve here. And you let me know if you have any pain at all in your fingers. Okay?
Okay.
Any pain?
No.
Okay, great. We'll try this right arm. Any pain?
No.
Okay, great. That's called the Tinel's test for carpal tunnel, to assess for carpal tunnel syndrome. I'm also going to ask you, Jordan, to put your hands like this. Lower your elbows. Any pain?
No.
That's the Phelan test to assess for carpal tunnel syndrome. Okay, very good. You can put your arms down. While we're in your upper extremities, Jordan, I'm going to go on ahead and palpate your brachial artery. It's nice and strong, 2+. I'm going to assess your radial artery. The radial pulse, nice and strong, 2+. Your ulnar, nice and strong, 2+. Check here. Nice and strong, 2+. Radial, strong, 2+. And ulnars, 2+. Let's see your capillary refill. Capillary refill is brisk. Arms are bilaterally symmetrical. Let's check your skin turgor. Skin turgor is elastic. We can also check on your sternum. Skin turgor is elastic. Okay, great. How are you doing? Doing okay? Okay,
Yes.
very good. I'm going to ask you, would you like to put your glasses back on, Jordan? You can put your glasses on. I finished your head HENT exam. Alrighty. Let's go on ahead now, Jordan. I'm going to put my fingers in your hands. I'm going to ask you to squeeze as tight as you can. Okay, good. Equal strength bilaterally. Thank you. All right. With your lower extremities, Jordan, what I'd like you to do is I just wanted to check your quadriceps muscle. Okay, great. Strong, even tone. There's no sense of atrophy. I don't see any. Okay, down here. Gastrocnemius, nice and tight, strong. You must be an athlete. Okay, great. What I'd like you to do now, Jordan, is to, on your quadriceps, I'd like you to tap your thigh with your hands and with the back of your hands as fast as you can, like this. Rapid alternating movements. Good, good. Coordination is great. Thank you. Very good, Jordan. Coordination is great. Okay, with your left leg, Jordan, I'd like you to kick out your left leg as if you're kicking a soccer ball. Any pain?
No.
I don't hear any crepitus. Okay, right. Great. Any pain?
No.
I hear no crepitus, no grating sounds. With your right foot, Jordan, just turn it around in a circle. Okay, the other way. I don't hear anything. No grating sounds. Any pain?
No.
Okay, do the same with your left. Okay, and then the other way. Okay, great. I'd also like Jordan to do a test of your coordination. With your left heel, I'd like you to pick up your left heel and then run your left heel down your right leg as fast as you can. And then go up. Great, good coordination. And now the same with the other leg. Okay, and then up. Okay, good. All right, let's check your patellar reflex, Jordan. You can let your legs hang down. Good. Good reflex, nice and strong reflex, brisk reflex, brisk reflex. Good, brisk reflex. And then we'll check your Achilles, which is right behind your heel, right above your heel. I'm just gonna hold your foot. All right. Okay, just relax, relax. Okay. Okay, great. Saw a little movement there with your foot. Okay. Relax. Okie dokie. And then what I'm also going to do now, Jordan, is I'm going to ask you to, I'm going to hold your feet, and then I'm going to ask you to tap my hand with your foot as quickly as you can. Okay? Okay, very good. Good, Jordan. You can stop. I don't see any clonus. Capillary refill is brisk to his toes. Let's see if I can palpate your pedal pulse. 2+ pedal pulse. Okay, great. And let's try on your right leg. Okay, tap fast as you can. Okay, good. And there's no clonus noted. And then I'm going to palpate your pedal pulse. Capillary refill is brisk. Okay, your toes are a little cool, but you've got no socks on. Okay, and then I can also too palpate, you've got a popliteal pulse back here, and when you're lying down, it might be a little easier to palpate. Okay, let's check your sensation on your arms and on your legs. Okay, Jordan?
Okay.
This is a dull touch. This is sharp. And then soft. Okay, I'm just going to check your sensation in your upper and lower extremities, okay?
Okay.
Close your eyes.
Dull.
Good.
Dull. Soft. Soft.
Okay, good.
Sharp.
Sorry, I know it is a little sharp. Bilaterally symmetrical. Okay, and then sensation on your legs.
Dull. Dull.
Okay.
Sharp.
Sorry, I know this a little sharp. Okay, great.
Sorry.
Okay, good. And then I'm also gonna, one more time.
Soft. Soft.
Okay, bilaterally symmetrical with his sensation. Close your eyes, Jordan. I'm going to put a series of objects in your hand, and I'm going to ask you to identify the object with your eyes closed, okay?
Okay. A pen.
Good.
A paper clip.
Okay, good.
A Q-tip.
Okay, good. And then last one.
A bottle.
Okay, very good. Okay, Jordan. So this concludes, this is part of your assessment with you sitting down. I'm going to have you stand up, Jordan, and face me. Okay. This is, I'm going to ask you to close your eyes with your feet together. Okay. We're assessing your Romberg test to see if there's going to be any swaying. There's no swaying and his posture is erect. Okay, you can open your eyes, Jordan. Go ahead and take off your shirt and then turn and face the wall, the window. Okay, great. And I'll take your shirt and put that down here. Okay, I'm just going to assess your posture. Posture is erect and straight, his spine. Any pain here, Jordan?
No.
Okay, great. I'd like you to bend to the left. I'm sorry, to the right side. Okay, as far as you can go. Okay, great. Any pain?
No.
Okay, and now the left side. Okay, good. Any pain?
No.
Okay, great. So spine and posture is erect, and there was no pain to his spinal column. He's able to move left to right. How about bending forward? Okay, good. And then bending backwards. Okay, great. Any pain?
No.
Any tenderness?
No.
Okay, great. Very good. Okay, Jordan, what I'd like you to do is come and stand over here, and I'm going to ask you just to walk to the couch just like you normally would walk. Okay, stop and turn around and face me. Okay, great. And then you're going to come back towards me, Jordan, and you're going to walk on your tippy toes. Gait is steady, there's no ataxia noted, and he's coordinated. You're going to walk back on your heels. Very good. Okay, excellent. And then you're going to walk back towards me, and you're going to do heel to toe. We call that tandem walking. I'd like to see what your balance is like. Okay. Okay, great. Okay, gait is nice and steady. No swaying noted. Okay, very good. Jordan, you can come on over here. I'm going to have you lie down on the couch. I'm going to do your cardiac assessment, your respiratory assessment, and your GI assessment. Okay, maybe you can scooch down just a little bit. Okay, and lie down. Okay, great. And these, my ruler and my card, I'm going to be using to assess your jugular venous pressure. Okay, like that? All right. So I'm going to start off with assessing your cardiac system. Okay, are you comfortable?
Yes.
Okay. So I'm going to just assess his precordium. His skin is appropriate in color for his ethnic background. I do not see on inspection any heaves. I don't see any bulges on his anterior thorax and his precordium. All right, I'm going to go ahead and palpate. Any pain was that when I palpate?
No.
Okay, great. And I'm going to auscultate your heart sounds. I'm going to have you auscultating. I'm going to auscultate while you're lying down, while you're turned to your left side, and also while you're sitting up. I'll be auscultating your heart. Okay.
Okay.
I'm going to use my diaphragm first of the stethoscope, and then I'm going to use the bell of the stethoscope to auscultate your heart sounds. You're going to find your second intercostal space to the right of your sternal border. This is your aortic valve. Okay. You're going to assess on the other side the second intercostal space, and that's your pulmonic valve. The closure of your aortic valve and your pulmonic valve signifies the second heart sound, which is diastole. Okay, then I'm going to assess Erb's point, then the tricuspid valve, and the mitral valve. The closure of the tricuspid and mitral valve signifies the first heart sound, which is contraction, or systole. Okay, I'll listen with the bell. Okay, great. And then the PMI is the point of maximum impulse. It's at the mid-clavicular line, the fifth intercostal space. S1, S2 are strong with regular rhythm. Jordan, lie to your side a little bit, but you can keep your head back like that. Okay, just like that on your left side. And I'm going to auscultate with the bell and with the stethoscope. With the diaphragm and with the bell of my stethoscope. Nice and strong. Nice and strong. Erb's point, strong, tricuspid, and mitral. And now with the bell of my stethoscope. Nice and strong as one, as two heard well. Okay, great. I'm going to assess your jugular venous pressure, and then I'm going to have you sit up a little bit so I can auscultate again with you sitting up to auscultate your heart sounds, okay? Let's check your jugular venous pressure. Let me grab my pen light so I can maybe see your jugular. Okay, just turn your face to the side, yeah, okay. I don't see any jugular venous distension, but let's measure, okay? Your jugular venous pressure. Okay. And then we're going to put the ruler on the sternal margin, my centimeter marking. Okay. It looks like it's about 1.5 centimeters. The JVP assesses the atrial, your central venous pressure, and it is satisfactory at let's say 2 centimeters. Okay, great. While I'm here, Jordan, I'm going to also auscultate your anterior chest and listen to your breath sounds. But I did actually want you to do one test, and I'm going to put my hand on your chest. I should have done this earlier, but I'm going to ask you to say 99.
99.
Okay, that's to assess tactile fremitus, and I heard a bilaterally symmetrical. Let's try it again. 99.
99.
Okay, great. I will ask you to say 99 when I listen with my stethoscope to see what I can hear while you're lying down, okay? And then when you sit up, I'll listen to your heart sounds. Anterior chest. Bilaterally symmetrical as he takes a deep breath in. Vesicular breath sounds are heard. Vesicular breath sounds are heard. Okay. Okay. And listen over your trachea for tracheal breath sounds. Yeah, okay, great. Okay. You know what, Jordan, I'm going to ask you to say 99 as well. Let me see what I can hear.
99.
Okay, good.
99. 99.
Okay.
99.
Okay.
99.
Okay, great. And then also say E.
E. E. E. E. E. E.
Okay, great. The E was kind of a muffled sound. I did not hear you say A. I heard you say E, but it's muffled, and the 99 was also muffled. And that's checking egophony and bronchophony. Okay, great. I'm also going to be assessing your abdomen, Jordan. I'm just looking at your abdomen. Could you lower your shorts just a little bit below your belly button for me? Just a little bit so I can assess. I'm going to listen to your belly buttons, your belly sounds. Okay. I'm inspecting his abdomen. His abdomen is uniform and contour. It is not protuberant overly. At his belly button, I do not see any signs of edema at the belly button or protrusion of the belly button, which may indicate a hernia. And there's no signs of bruising or ecchymosis, which may tell me that he's got some internal abdominal hemorrhage or bleeding internally. Don't see any of that. I'm going to auscultate and listen to your belly sounds. I'm also going to auscultate your arteries. You've got some arteries that I can auscultate, and I'm going to listen to see if there's any sounds of turbulent blood flow. Active bowel sounds. Active bowel sounds. Active left upper quadrant. Active left lower quadrant. Bowel sounds. Great. I'm going to auscultate just above your belly button. All I hear is bowel sounds. I do not hear any turbulent blood flow. This is over your aorta. Your renal arteries up here. Your iliac artery. And then your femoral artery. Okay, and then on the side, renal, iliac. There's no sounds of turbulent blood flow in your femoral. Okay, great. Okay, I'm going to just lightly percuss. Okay, Jordan? Let me just take off my gloves. tympanic sounds heard in your belly. Okay, any pain, Jordan? How about pain over here at McBurney's point? This is your right lower quadrant. Any pain here, Jordan?
No.
Okay, great, very good. I'm going to auscultate. I'm going to percuss to see what the your liver span size is. Okay, I'm going to start from up here where the resonant sound of your lungs are resonant, nice and resonant. Okay, about here it's dull. Let me just get my little stickers just to mark it so I can measure properly. Let's try again. Nice and resonant. Okay, that's dull right there. So this signifies the top of your liver margin. Okay, and then I'm going to start from below your belly button, and I'm going to percuss, and then where that tympanic sound gives way to dull. Okay, about right here, this was where the dullness started, right there. Okay, I'm going to measure your liver. About 7 centimeters at the midclavicular line. Okay, your spleen is on the left side. It's typically not palpable in a young adult to palpate your spleen unless there was an issue. I'm not able to palpate anything there. It's like your mid-axillary line, not palpable. Okay, great. This over here is your right costal margin, Jordan. Are you having any pain on inspiration? Take a deep breath in. Any pain? No?
No.
Okay, great. I'm going to put my hand on your knee right here. I'm going to push down. You raise your right leg up and let me know if you've had any belly pain. Any belly pain?
No.
Okay. I'm going to lift up your right leg and bend your leg, and I'm going to turn it like so. Any pain in your belly?
No.
And I don't hear any crepitus on the joint, your hip joint. Let's raise your leg up. Are you having any back pain when I do this?
No.
Okay, and I don't hear any crepitus or any type of sound to concern me with your joint. Okay, Jordan. So let me put this down here. All right, so I've assessed your cardiac system. Let me go ahead and check your capillary refill. It's brisk. Brisk capillary refill on both sides. All right, let's see, what else? Why don't you go ahead and sit up for me, Jordan? Just sit at the end of the couch right here. Turn your legs out this way. Okay, we're gonna listen to your heart again in those 5 areas. If you're sitting up. So the aortic, the pulmonic, Erb's point, tricuspid, and mitral. Okay, great. And Jordan, I know that you're sitting up, and I just wanted to let you know that when I was checking your legs, I was checking to see if you had any abdominal pain, which might indicate some type of appendicitis. The leg raising was the iliopsoas muscle test, and then when I turned your leg in and out, that was the obturator test, okay? And then checking up here with when I was touching your right upper quadrant, your right coastal margin, excuse me, that was the Murphy's test, and they were both negative. Okay, Jordan, why don't you just scooch down a little bit and have your feet touch the floor. There you go. Okay, I'm going to be checking at the back right here to assess for any costovertebral angle tenderness. Any pain?
No.
Any pain?
No.
Okay, very good. And go ahead, Jordan, and stand up for me. We're almost done. Turn around and face me. Actually, turn on the back. I'm sorry. So your back is to me. I'm going to be percussing for assessment of your diaphragmatic excursion. Okay? And actually too, before I do that, let me auscultate your back with my stethoscope, and I can hear what your back sounds like. The back where your lungs are at the back, posterior. Deep breath. Okay, lung sounds clear. Vesicular. Okay. I do hear some bronchovesicular sounds also back here. Take a deep breath. Okay. Okay. Alrighty, I'm gonna percuss. Oh, first of all, let me give you some instruction. So go ahead, Jordan, and take a deep breath and hold your inhalation. I'm percussing down, and where resonance turns dull. Okay, go ahead and you can breathe, Jordan. Okay, I'm going to put a little sticker there. That's where the resonance became more dull. And then I'm going to start from the bottom and percuss up. Okay, and this time I'm going to ask you to take a deep breath, exhale, and hold your exhalation, okay? Here we go. Okay, resonant, right about there, resonance. Okay, on the right side, I'm just going to put a little sticker there. Okay, and then we'll check the left side. Okay. Okay, same thing, take a deep breath and hold it. Nice and resonant. Okay, a little dull right there. I'm going to put the sticker on there just to mark it, and I'll see what your diaphragmatic excursion is. Okay, we'll start from the bottom, and then I'm going to ask you to take a deep breath, exhale, and hold your exhalation, okay? Okay, there's the resonant sound. Put a little sticker there to mark, and I'll be able to measure. Diaphragmatic excursion. It's about 6, almost 7 centimeters on the left, and on the right, it's a 6. It's not quite 7 on the left, but 6 centimeters for your diaphragmatic excursion. Okay, Jordan. I'll take off those stickers. I think that concludes our assessment, Jordan. I've done your assessment, and I will make a documentation in the chart. I'll take these off. I'll make a documentation of what my findings are in the chart. Do you have any questions?
No.
Well, thank you so much. I appreciate all your time.